Well, welcome to this lesson on the female reproductive system. We want to start off by looking at the external female genitalia, then think about the internal genital structures, and then relate this to the processes of conception and gestation. So thinking first about the external female genitals, these consist of the labia majora, the labia minora, the clitoris, vestibule, vestibular glands, vaginal orifice and hymen. And collectively this area is described as the vulva. The internal organs of the female reproductive system are also located in the pelvis, and the principal structures involved are the vagina, uterus, two uterine tubes formerly called fallopian tubes, and the ovaries. But let's first think about the external genital structures. Now the labia consist of the labia majora and the labia minora. The labia majora are two large longitudinal folds composed of skin, fibrous tissue and adipose tissue. And labia refers to lips and majora means larger. These structures are covered by pubic hair and contain a large number of sebaceous and sweat glands. And these structures are normally in contact with each other, closing off the vulva. Now the labia minora are two smaller folds of skin lying within the labia majora. Minora of course means smaller. And these structures do not have pubic hair or contain fat like the labia majora, but do contain sebaceous glands. Oily sebum produced by these glands help to lubricate the area and form a barrier against infection. The longitudinal cleft between the labia minora is termed the vestibule. Posteriorly, in the vestibule is the opening of the vagina. Anteriorly, that is towards the front in the vestibule, but posterior to the clitoris is the urethral orifice. Now there are also two vestibular glands, formerly called Bartholin's glands, one located on each side of the vaginal opening. And these glands have ducts which secrete mucus into the vestibule to keep the vulva moist. The clitoris, which is very sensitive, is the structure located at the anterior junction of the labia minora. So it's towards the front of the labia minora. And the clitoris is homologous to the male penis. It is a small cylindrical mass of erectile tissue. The external exposed part of the clitoris is the glans clitoris. So in the same way there's a glans penis, there's a glans clitoris. Many sensory nerve endings are located within the clitoris. In appropriate emotional situations, the clitoris is the principal sensory structure which stimulates a female orgasm. An orgasm describes the climax of the pleasurable sensation associated with sexual activity. Now, in some cultural situations, the clitoris is unfortunately mutilated, and as healthcare professionals, this is something that we have absolutely nothing to do with and always seek to combat. The hymen is a thin layer of mucous membrane which occludes the opening of the vagina in young girls. However, it must be incomplete to allow menstrual flow and may be completely disrupted if tampons are placed into the vagina. It may also be disrupted by exercise or gymnastics or other physical activity. The perineum is the area inferior